Good morning, students. Let's start today's class with the endocrine system. When you are start thinking what are the endocrine system, actually the endocrine system consists of endocrine glands. So what are these endocrine glands? Actually, if you have come across, I think you have come across some other glands also, like whatever you are saying as sublingual glands, salivary glands, these are also the glands. But what is the difference between the endocrine glands and other glands which are present? So when you see the endocrine system, it consists of group of glands that produce hormones. Endocrine system is that system which produces hormones. One more, the most important thing here is the endocrine system works with nervous system, means it coordinates with the nervous system to control all other body systems. It might be GIT, it might be reproductive system, it might be respiratory system, any other system. So this endocrine system, it coordinates with the nervous system to control all the body functions. It affects the body systems by chemical stimuli, because endocrine, they secrete some hormones. All hormones what you are seeing, these are the chemicals. So they affect the body system. As such, we are saying the endocrine system produces hormones. These hormones are all chemicals which they control that of the body. So first, coming to that of the, we said endocrine system, these are the glands. So first, let us going into the deep about the endocrine system. First, differentiate what is an endocrine and what is an exocrine gland. Why these glands are not same as other gland, what you are seeing as submaxillary, sublingual, why they are different from these glands. First, any gland is that which secretes particular chemical substance. Any substance, if the gland is secreting, then it is called as, if it is secreting, then it is called as a glands. So, whole in our body, there are three types of glands in our body: endocrine glands, exocrine glands, and heterocrine glands. So, normally, if it is asked, what is a gland? Anything, an organ which secretes any of the substance. It is a chemical substance or any of the substance. If it is secretory in function, then it is called as a glands. So in body, there are about three types of glands in our body. That is endocrine, exocrine, and heterocrine glands. So first coming, what is an exocrine gland? So exocrine glands are the glands that secrete their products into the ducts. So you can see that of your sweat gland. It is secretory, it is a gland only, but it secretes their products into that of the ducts. So this is that of your ducts, and they pour their secretions out. So the gland which is secreting, and they pour their secretions into the duct. Whatever it is secreting, they are pouring the products into that of the ducts. So these are called as exocrine glands. What these exocrine glands are? Example, if you go, what are these exocrine? Sweat glands are exocrine glands that secrete their product into the ducts. Salivary glands, yes, they come under exocrine glands. Mammary glands come under exocrine. Stomach, though it is not a gland, but in that there are some structures which is secretory, which pour the stomach. They consist of some cells which are secretory in nature. So they pour their secretion into the duct. In that way it is called liver. I think you have heard that class recently only. It is also a gland. What is the type of gland is exocrine gland, because they pour their secretions or secrete their products into that of the ducts. Yes. So if it is asked what is exocrine gland, the gland which has ducts in it, because if they have to pour their secretions, they need to have a ducts. So any gland having ducts in it, it is called as exocrine glands. Now, what is an endocrine gland? Gland that secrete their products. Normally, now we knew it. So, what products it secretes? Hormones. But they doesn't pour the secretions into the ducts. Do you remember? They doesn't. But they directly pour into the blood. They are directly, whatever they are secreted, whatever the hormones it is secreted, they are directly released into the blood rather than that of a duct. So that is the difference, major difference between endocrine glands or exocrine glands. So if you ask what is the difference between endocrine and exocrine glands doesn't have any ducts. They pour their secretions directly into that of the blood. But unlike the exocrine glands, they are all the glands which are having ducts. They pour their secretions into that of the ducts. So that is a major difference between the exocrine and endocrine gland. Exocrine glands have ducts. Endocrine glands doesn't have ducts. They, whatever secretion they are secreting or whatever chemical substances they are secreting, they are directly released into that of the blood. That is a major difference that you have to know what is the endocrine gland. The examples in our body, there are many endocrine glands like pituitary gland is an endocrine gland, thyroid gland is an endocrine gland, suprarenal gland is an endocrine gland, ovaries, pancreas, testes. So these all come under endocrine glands. They secrete something that is a chemical substance which they directly pour into the blood. Yes. When we started our class, we said the glands are divided into three: exocrine glands, endocrine glands and heterocrine glands. I think by now you have got to know what is the exocrine and what are endocrine glands. Now let us see what are heterocrine glands. So these are the glands that perform both exocrine and endocrine functions. So pancreas is such a organ. It does both functions. It does one exocrine function, one endocrine function. If I have to tell, the exocrine function of the pancreas is, pancreas has a duct. So as such we have said exocrine gland should have a duct. Yes, it has a duct. Whatever secretions, the juices it is secreting, it is pouring into the duct. So in that way, pancreas has become exocrine gland. Same way, endocrine function. In pancreas, there is a part which is secreting a chemical substance that is a hormone like insulin. So, in that way, pancreas does both endocrine function and exocrine. So, they come under the type of a gland which are called as heterocrine glands. So, now you have come to know what is endocrine, what is exocrine and what is heterocrine glands. Before going deep into that one, I would like to tell again the demarcation between the exocrine gland, endocrine gland and heterocrine glands. Normally, a gland is anything which is secretory. In that, these glands are of three types: exocrine, endocrine and heterocrine. First, coming to the exocrine gland, the glands which have ducts, means whatever secretion it is secreting, they are pouring into the ducts, then they are called as exocrine gland. In our body, there are many exocrine glands like sweat, salivary, mammary. They come under exocrine glands where they secrete some substances into the duct. Coming to the endocrine glands are those glands which also secrete, but they secrete their products, they directly release their products into the blood, not into the ducts, because these endocrine glands are all ductless. They doesn't have any ducts. So they pour their secretions directly into the blood. So these are pituitary, pancreas. Pancreas, why it is included here in endocrine? Because it is both exocrine and endocrine. You can include at any part. Pituitary gland, thyroid gland, adrenal gland. These are all endocrine glands which pour their secretions directly into that of the blood. Next type of glands are heterocrine glands. The glands which perform both exocrine function and endocrine function, they are called as heterocrine glands. The best example for heterocrine is pancreas because it does both exocrine and endocrine function. The exocrine function of pancreas is it secretes some digestive juices because it has a duct, as such we have said. If it is having duct, then it is called as exo. Yes, pancreas has a duct which is called as pancreatic duct. Endocrine function of the pancreas is like insulin, it is secreting from islets of Langerhans. So these are called as heterocrine glands because they perform both exocrine and endocrine functions. Now going endocrine glands. So by now we understood the endocrine glands are ductless. They secrete some chemicals which are called as hormones. So now let's see what is a hormone is. What are hormones actually? Hormones are all chemicals which are produced by specialized cells. They are all produced by specialized cells, secreted, or they pour their secretions directly into the bloodstream and they take into that of the target tissues. So the hormones are all chemicals which are produced by specialized cells and they pour their secretions directly into the bloodstream. That is the main important thing. So what is a hormone? It is a chemical substance where they pour their secretions into the bloodstream. So if it is a chemical, what is the chemicals? What are the things? So it consists of steroids. Steroids, hormones are lipids. So what they are made up of? If you have heard the biochemistry class, I think you might have come across cholesterol, steroid. In that way, steroids are the hormones, are the lipid molecules. They are the lipid molecules. They have cholesterol as a precursor. Means from the cholesterol, the steroid you are getting it. So hormones are steroid in nature. These steroids are produced namely by 4 organs such as adrenal, it is also what called as suprarenal gland, ovaries, testes and placenta, which are produced. Means steroids are produced by these 4 organs. Yes, so that is what about that of the hormone. So endocrine gland secrete hormone. Now you know what is a hormone is. Hormone is a chemical substance which is pour the secretions into bloodstream. So what in the hormone, what is it is made up of? All hormones are made up of. These are made up of a chemical substances such as that of the steroids. Steroids are the hormones where the precursor for the steroids are the cholesterols, which are the lipid molecules. So mainly these steroids are produced by 4 organs such as adrenal, ovaries, testes and placenta are the organs which are responsible for the production of these steroids. Next, as such we have said, whatever the endocrine means hormones which are secreted by the endocrine glands, you can see here they are directly poured into that of the bloodstream, you will be getting it. So endocrine system consists of the glands, these are the glands, and some capillaries are present which facilitate diffusion of hormones to the of your bloodstream. If you understand what is diffusion, what is a diffusion? The meaning of diffusion is flow from higher concentration to that of the lower concentration. So the endocrine glands, they have secretory vesicles, they secrete some hormones. So here it is more. So diffusion is from higher to that of the lower. So they directly pour their secretion or diffuse from these to the top of the bloodstream. These are called as commonly because of which they doesn't have their ducts. As such, I have said the starting only, these are all ductless glands because the whatever secretion, whatever the hormones or the chemical substances, steroids which is secreting, it is directly poured into that of the bloodstream. Yes. Now, we have known what is a hormone is. Hormone is the chemicals. These are steroids. These steroids are they are produced for some organs. But these are the chemicals. As such, these are the chemicals. So chemical messengers, the hormones, the chemical messengers, which with which their regulatory effects on the cells or the organs. Some affect many tissues like growth, thyroid and insulin. These are the hormones which affect many tissues. So they act as a messengers. They affect many tissues like growth hormone, thyroid and insulin. Some affect the specific tissues. Means here they are affecting many tissues. Means in a group of a tissue. But here in sometimes the hormones affect only a specific tissues. Like there are some specific tissues like thyroid stimulating hormone. They affect only the specific, that is thyroid gland. Adrenocorticotropic hormone, they affect only the specific, that is suprarenal gland, that is also cortex of the supra. So in this way you can say what hormones are the chemicals. These chemicals, some places they affect most vascular tissues, many tissues they will be affect, but sometimes they also affect the specific tissues like target tissues only they might be affecting. Yes. When you see this endocrine system, as such we have said, the endocrine system consists of number of glands. So, in our body, what are the endocrine glands? What are the endocrine glands? Where they are situated? What they are secreting? What these functions? Let's see in detail. So, when you are seeing the number of endocrine glands, it consists of pituitary gland, thyroid gland, parathyroid gland, suprarenal and adrenal gland, pancreas, thymus. So these are all the endocrine glands. Yes. So they are all the endocrine glands present in our body. Here you can see the pituitary gland. Yes, this is the pituitary gland which is present in that of your brain in the sella turcica. Thyroid gland along with parathyroid. Suprarenals above the kidney. Pancreas, ovaries, testes. So these are all the endocrine glands which are present in our body. Now let's see the each endocrine gland in detail up to your extent. So first coming to the pituitary gland. So I think here you can see at this place, means in the brain the pituitary gland is present, is situated. Yes, the pituitary gland is a pea-sized, peanut-sized mass of glandular tissue. It is a mass of small, like a peanut or a groundnut, what we are saying, that much sized shape of which is present in that of the glandular tissue which lies in the sella turcica of the brain. So sella turcica is present in the brain at this part. So in that part you see some glandular tissue which is of the size of the peanut shaped size. So it is a glandular tissue which is present in sella turcica. That gland, pituitary gland, it consists of a slender stalk which is called a infundibulum. That infundibulum connects pituitary gland with that of the brain, that is called as hypothalamus. So here pituitary gland is present. Yes, this pituitary gland has some stalk. Yes, like if you see flower, rose or any of the stuff, it consists of a stalk. That stalk is connected to that of the hypothalamus. It is connecting the pituitary gland, which is a small peanut shaped. It is connected to that of the hypothalamus by means of that of the stalk. So in that way, that pituitary gland which is present in the sella turcica, it is connected to the hypothalamus by means of an infundibulum. So this infundibulum connects pituitary gland to that of the hypothalamus. It will be connecting. So, when you see the pituitary gland, that peanut-shaped glandular tissue, it consists of two parts mainly, that is neurohypophysis and adenohypophysis, and also intermediate part also. But let's start with the three parts. Actually, it is divided into three parts: neuro, adeno, and that of intermediate part. Yes, but again it is dividing. But first, it consists of two parts, that is neurohypophysis and adenohypophysis. The main function of the pituitary gland is it indirectly, not directly, it indirectly controls growth, metabolisms like carbohydrate, protein, lipid metabolism. It also controls the sexual reproduction, lactation of the milk or ejection of the milk. It is all under the control of pituitary, but not directly connected. It is indirectly controls all these functions. As such, we have said the pituitary gland consists of that peanut-shaped glandular tissue which is present, which is connecting to the hypothalamus by means of infundibulum, consists of two parts, that is neurohypophysis and adenohypophysis. The adenohypophysis is the anterior lobe. This is the anterior lobe of the pituitary gland which is connected to the hypothalamus by means of infundibulum. Neurohypophysis is a posterior lobe, yes, which convey the hormones directly into the hypothalamus. Means hypothalamus is having a nucleus. It is connected by hypothalamo-hypophyseal tract which is going on in between. So that is called as posterior lobe. So adenohypophysis is called as anterior lobe. Neurohypophysis is called as that of the posterior lobe, which is influenced, which consists of the top here axons which are present here which you can come across. They are connected to the top the hypothalamus, which they are connected to that of the brain. Yes, the hormones which are secreted, we said the pituitary gland consists of anterior lobe and that of the posterior lobe. Anterior lobe is the adenohypophysis, posterior lobe is the neurohypophysis. In between the anterior and the posterior lobe, there is one more lobe which is called as that of the intermediate lobe, which will be present between that of the adeno and that of the neurohypophysis. So, what the hormones they are secreting is, so when you now say the pituitary gland consists of anterior lobe, posterior lobe and also the intermediate lobe which is present. The anterior lobe of pituitary gland secretes growth hormone, prolactin, thyroid stimulating hormone, adrenocorticotropic hormones, follicle stimulating hormone, luteinizing hormones are some of the hormones which are secreted by anterior lobe. Intermediate lobe is which secretes melanocyte stimulating hormone. Posterior lobe secrete vasopressin and oxytocin. Antidiuretic hormone is called as vasopressin and oxytocin is secreted by the posterior lobe. So, whatever we are seeing here, it consists of three lobes: adenohypophysis, neurohypophysis. Adeno is called as anterior, neuro is called as posterior lobe. In between the anterior and posterior, there is one more lobe which is called as an intermediate lobe. So, when you are seeing adenohypophysis at the anterior lobe secretes these many hormones: growth, TSH, thyroid stimulating, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone. Whereas the intermediate lobe secretes melanocyte stimulating hormone. Posterior lobe secretes vasopressin and oxytocin are secreted by means of the posterior lobe. So this is the posterior lobe which is secreting oxytocin and vasopressin, that is a vasopressin antidiuretic hormone or milk ejecting hormone, vasopressin and oxytocin is secreted by that of the posterior lobe. The anterior lobe secretes some of the growth hormone, thyroid stimulating hormone, adrenocorticotropic hormones or sexual hormones which are secreted by anterior lobe. Between these there is one more lobe which is called as the intermediate lobe which secretes melanocyte stimulating hormones. Hence, I think here you can see the anterior and posterior lobe. Mainly the posterior lobe is connected to the hypothalamus by means of some hypothalamo-hypophyseal tract which connects the posterior lobe and even the anterior lobe to that of the hypothalamus by means of the infundibulum. So, this is the infundibulum by which this P or a glandular tissue is connected to the hypothalamus by means of the infundibulum. Yes. Same thing, adenohypophysis, the differentiating feature between adeno and neurohypophysis coming to the top of lobes. Adenohypophysis is a large anterior lobe. Neurohypophysis is a small lobe, posterior lobe. Both the lobes secrete some hormones. Adenohypophysis releases hormones, but neurohypophysis stores some hormones such as oxytocin and antidiuretic hormone is whenever it is needed, by means of hypothalamus hypophyseal tract it will be going on, but it stores the hormones, but adenohypophysis releases the hormones like growth hormone, thyroid stimulating hormone, adrenocorticotropic hormones, luteinizing, follicle stimulating, even the top here that is intermediate lobe which is secreting melanocyte is also the releasing hormones which are present in adenohypophysis, not only in the anterior lobe, also in that of the intermediate lobe. Yes. When you see the each hormone, that is the first, when you have seen the anterior lobe, it secretes a hormone which is called as that of the growth hormone. When you see the growth hormone, it stimulates the growth itself. It stimulates the growth of the bones, cartilages and connective tissue. So, it stimulates the growth of the bones, cartilages and even the connective tissue it will be stimulating. So, in that growth hormone, somatomedins are synthesized in the liver. The liver synthesizes somatomedins in response for the stimulation of the growth hormone. So, when growth hormone is stimulated at that time from the liver, somatomedins are synthesized in that of the liver, which is helpful for that of the response. So, what is the response of the growth hormone? So, that response which is you are getting from the liver somatomedin, these affect the growth hormone on the skeletal system of that of the growth. It will be reflecting its effect on that of the skeletal system. Yes, growth hormone, that is a somatotropin. So, the major hormone regulating the growth in the body is a growth hormone. That too, the growth hormone is only called as somatotropins. So, this is a major growth, that is a growth hormone which is regulating the body's growth. Actions of the growth hormone is, so we have said when growth hormone is stimulated in the liver, somatotropin is released. This somatotropin acts on, it increases skeleton growth, increases the muscular growth, increases the amino acid, that is metabolism of the proteins, because protein metabolism only growth goes on. So, when the proteins are metabolized, that time skeletal growth or muscular growth takes place. Yes, increases uses of lipid, that is lipid metabolism, decrease the storage of carbohydrates. So, growth hormone decreases the storage of carbohydrates but increases the storage of proteins and that of the lipids. Yes, that is the action of the growth hormone on metabolism or on the growth of the skeletal system. When you see the growth hormone on protein and mineral metabolism. On protein metabolism, growth hormone is a protein anabolic hormone. It is a protein anabolic hormone on proteins. Yes, it is helpful for construction, not destruction, but increases the metabolism of the proteins. That is a meaning there on protein metabolism. On mineral metabolism, growth hormone is responsible for increased calcium absorption, decreases sodium, potassium, calcium and phosphorus excretion from the kidney, increases the absorption but decreases the excretions from the kidney. So, this is the effect of minerals, growth of hormone, effect on mineral metabolism. When you have seen the carbohydrate, then earlier also we have seen carbohydrate, growth hormone decreases the effect of the carbohydrate or decreases the secretion of the carbohydrate. So, growth hormone is a diabetogenic because it produces hyperglycemia. It decreases that one. In that way, it produces that of the hyperglycemia. On fat metabolism, growth hormone acts as a catabolic effect that increases the mobilization of fats from that of the adipose tissues. Yes, the growth hormone is primarily under the control of hypothalamic hormones like releasing hormones and inhibiting hormones. Secretions by stimulating of growth hormone, releasing hormone releases during. So, when it is released during, that is released during whenever you do exercises, whenever there is a stress, at that time it is stimulated. So, that time it is released. The stimulate decreases the growth hormone secretion by releasing growth hormone inhibiting hormones. So, sometimes it increases, sometimes it decreases. So, when growth hormone releasing hormone increase is during exercise and when you are in stress, at that time it releases. But when it is inhibited secretion by release of growth hormone inhibiting hormones like somatostatin. When this hormone is released at that time, it is inhibiting that of your growth hormone secretion. So this is that of your growth hormone which is secreted by, as such we have said, the anterior pituitary among many hormones such as growth hormone, thyroid hormone, pancreatic, all these hormones, the anterior pituitary, one is among them is a growth hormone. The growth hormone, what it is, when it is stimulated from the liver, somatostatin is released. Okay, that is released. That affects on the skeleton, yes, which increases the cartilage bone formation. Other than that, it is increasing the protein synthesis and also that of your fat metabolism, but inhibiting the carbohydrate metabolism. So this is the way what it is acting. So whenever you are saying it is helpful in that of your hyperglycemic effect, anti-insulin actions also it is doing this growth hormone. So they are all under the control of the of your hypothalamus, which secretes growth hormone releasing hormone and growth hormone inhibiting hormone. That is the regulation of the growth hormone. Same thing. Yes. Diseases which are related to the growth hormone is gigantism. That is gigantic growth. Here you can see the person, how tall he is, gigantic. It is due to the overproduction of the growth hormone. When there is overproduction of the production of the growth hormone during adolescence, at that time there is the condition which is called as gigantism. The person grows abnormally tall. So the character feature of gigantic person is he is tall stature, bilateral gynecomastia is seen, means their breast looks like that of the females, bilateral gynecomastia, large hand and feet you can come across. So this is the disease which is overproduction of the growth hormone leads to a condition which is called as gigantism. The meaning itself, the person grows abnormally tall. Yes, excess production of growth hormone leads to another condition which is called as acromegaly. So here you can see the acromegaly. It is due to the excessive secretion of the growth hormone. It is what are the features of acromegaly is broad, thick nose. Nose you can see it is broad, it is thick nose. Skin is thickened, prominent eyebrows, prognathism, that is elongation of the mandible. Mandible comes in front, that is widening of the mandible you can see, that is elongation of the mandible. So that is due to the excessive production of the growth hormone. So this condition is called as acromegaly, where there is thick nose, broad thick nose, next prominent eyebrows, and the main important thing is elongated mandible, prognathism, where the mandible comes, widening of the mandible. So that is called as acromegaly. One more. That is those two conditions, that is gigantism and acromegaly, are the two disorders where there is excessive production of the growth hormone. But when there is deficiency of growth hormone, when there is decrease in secretion of growth hormone, what is the pathological condition that you get is dwarfism. You can see this is a dwarf due to the growth hormone hyposecretions. There the person is short stature, small genitalia, yes, and delicate extremities. Unlike when there is a growth hormone excessive, the extremities, that is tall stature, you have both bones which are growing very long, but here the delicate extremities, short stature, it is due to the deficiency of growth hormone which causes the condition which is called as dwarfism. Yes. One more, growth hormones also acts, there is hormone, that is one more hormone it controls is prolactin. So what is the function of the prolactin? What does it does? Prolactin plays an important, when you have seen in the first, so what are the anterior pituitary hormones are? We said it is a growth hormone. Other than that, the next one is that of your prolactin. So up till now we have said what is a growth hormone, what is excessive growth part, what is the, if the conditions of the growth hormone, such as if there is excessive production, acromegaly and gigantism. If there is less production of the growth hormone, it is leads a condition which is called as dwarfism. Next, let's see the another hormone which is secreted by the anterior pituitary, which is called as that of the prolactin. So what is this? The function of the prolactin? What is does? Prolactin plays an important role in the development of mammary gland. Mainly, it helps in the synthesis of the milk. So synthesis of the milk is done by that of the action of the prolactin. So plays an important role not only in the development of the mammary gland, also in the synthesis of the milk. Yes, how this function? They act by stimulating the factor which is called as prolactin releasing factor. That prolactin releasing factor is when it is released, it is stimulated. When prolactin is stimulated, when you do exercise, when there is emotional stress, during pregnancy and breastfeeding. At that time, the prolactin is stimulated, the secretion of the prolactin is increased. Inhibitory factors which is released by hypothalamus. Hypothalamus inhibits the prolactin secretion from the anterior pituitary. Dopamine may be the another prolactin inhibiting factor, but the main factor is the hypothalamus. This inhibits the prolactin secretion. So let's see the hypofunction of the pituitary gland. Just now we have said pituitary gland hypofunction retards the growth of the larynges. Not only up till now we have seen if there is less function of the pituitary glands, what happens? Dwarfism. Other than that, it also retards the growth of larynx. Larynx, and other day we have discussed, it's a voice box. Even the voice is affected. So, because of that, the hypofunction of the pituitary gland, it causes reduced production of the hormones of the ovaries, testis, resulting in the absence of the voice because it is on effect is also of the larynx. So there is a voice change that typically occurs during puberty. You can see the male voice, suddenly the boy who was talking very mildly at the puberty time, his voice is increased. So this is the function of the pituitary gland where there is a mild voice change. Hypofunction same way of adrenal gland can also cause similar effect, that is prepubescent voice in the boys, that is only called as voice change. Normally there might be a voice change during puberty. Not only it is because of the pituitary gland hypofunction, it is also due to the adrenal gland hypofunction also. This voice change might be seen, that is hypofunctioning of the adrenal gland. There might be a change which is called as prepubescent. Before the puberty only, there might be a voice change in that of your voice. Yes, as such earlier also we have said acromegaly. We have seen there is a prognosis, that is mandible is protruded, thick nose is present. Yes, so acromegaly results when there is excessive growth hormone during the puberty. So during puberty, if excessive growth hormone is produced, so the person suffers with a condition which is called as acromegaly, where there is a nose that is thickened nose, or the broad nose you can see, and the mandible, that is hypognathous, where there is protrusion of the mandible out. The high levels of the growth hormone affect the vocal folds by producing the characteristic thick, deep voice. The voice is thick voice, deep voice, but when you see this slowing of the speech gets slowing there and here. So that is a high level of the growth hormone effect. Yes, the posterior pituitary I have kept it again, yeah. But let's see the one more. The anterior pituitary hormone secreted. So up till now we have seen the growth hormone, prolactin. Let's see one more hormone which is secreted by the anterior pituitary, that is thyroid stimulating hormone. It stimulates thyroid. Yes, it stimulates the thyroid gland. Because of its stimulation, it produces two types of the hormones, that is thyroxine and tetrathyroxine, that is T3 and T4, along with that of the TSH, thyroid stimulating hormone. These are the hormones which it is produced from the thyroid gland. So when you see the thyroid gland, where it is present, when you see the anatomical feature of the thyroid gland, where it is situated, the thyroid gland. So this is the thyroid gland. It is situated in the neck, in front of the larynx and the trachea. So this is that of the larynx. Other day we have said the larynx, the paid and unpaid cartilages. So in front of the larynx and trachea, there is a butterfly shaped gland which is called as a thyroid gland, which measures about 25 grams. Both lobes. Thyroid gland consists of 2 lobes which are joined together by means of the isthmus. The isthmus is a connecting link between the 2 lobes of the thyroid gland which is present in the neck. Yes. So anteriorly it is related to the larynx and the trachea. So 2 lobes are connected by isthmus. Normally the size of the thyroid gland increases during puberty and pregnancy. It increases the size, whatever 25 grams we are saying, small change in the size may be there during puberty and the pregnancy. The other thing, important thing is there is rich vascular supply of the thyroid gland and hormones in short period of the time. So rich blood supply able to deliver high levels of the hormones in the short. So high hormones like tetrathyroxine, whatever T3, T4, TSH, thyroxine, triiodothyroxine, tetrathyroxine, whatever hormones, it is produced in a short time. How it is produced? It is because of the rich vascular supply what the thyroid is having. Calcitonin is involved, but calcitonin is also other which is involved in the calcium and phosphate metabolism or maintaining the balanced hemostasis. The main functions of the thyroid is its regulation of the carbohydrates, that is carbohydrate, lipid and protein metabolism, central nervous system activity and brain development, cardiovascular stimulation, bone and tissue growth and development, gastrointestinal regulation. So these are the some of the functions of the thyroid hormone. So if you functions have kept it, highlighted it, it is a regulation of the metabolism. It controls the growth of the central nervous system, even stimulation of CVS cardiovascular system, bone and tissue growth. Other than that, it also regulates the gastrointestinal tract. We have said the thyroid gland secretes T3, T4 and TSH. What is T3 is doing? What it is affecting? Triiodothyroxine or triiodothyronine. It affects almost every physiological process in the body. So all the process in the body like growth and development, metabolism, the regulation of the body, that is homeostasis, heart rate, it is all under the control of triiodothyroxine. Thyroxine, which is tetraiod, that is T4, it controls the development and maturation. Excess thyroxine results in the rapid development. When there is deficiency of thyroxine, it leads to delayed development. Next, other than T3 and T4, one more hormone which it is secreted is thyroid gland which is secreting is calcitonin. So it is a hormone which is secreted by the C cells. When you take a cut section of the thyroid gland, there you get it, the C cells. These C cells of the thyroid gland secrete calcitonin. That calcitonin is helpful to increase the calcium, bone calcium, to decrease the blood calcium level. It increases the bone calcium, that is absorption of the calcium, which is helpful for the growth of the body, but it decreases the blood calcium. Calcitonin opposes the effect of parathyroid hormone. Whatever parathyroid hormone is it, the opposite effect is that of the calcitonin. It acts to increase the parathyroid, increases the blood calcium level, whereas calcitonin decreases the blood calcium. So in that way we say calcitonin decreases, whereas PTS, the parathyroid hormone, increases. So in that way it opposes the calcitonin as the opposite action of parathyroid hormone. Yes, thyroid gland is not absolutely essential for life, but it removal in adults. If thyroid gland is removed, what happens? Poor resistance to the cold, mental and physical slowing, because it is responsible for physical growth and even the mental growth. So that mental growth is what we are getting. It is weakened or it becomes slow, and there is a mental retardation, dwarfism. The growth is retarded, because of which the person suffers with a thyroid dwarf. That is what the pituitary dwarf that earlier you have seen. It might be cretinism, what we say it. So it might be thyroid dwarfism also. The person can suffer if there is a thyroid removal. Yes, what are the disorders? Here is hypothyroid. It arises due to the low production of the thyroid hormones. Hyper, it is due to the more production. Yes, there is one more condition which is called as thyroiditis. What is this thyroiditis? It occurs when there is a production of thyroid levels may decrease. So this causes the inflammation of the thyroid. The way there is abnormal growth of the thyroid gland, nodules or lumps in the thyroid, and it is also because of the cancer of the thyroid gland, because of which the thyroid gland is inflamed, resulting into a condition which is called as thyroiditis. Yes. What features we see the person suffering with hyperthyroidism? If there is more secretion of the thyroid hormone, or if there is a less secretion. So what symptoms? In hyperthyroidism, there is weight loss. There will be increased heart rate. Intolerance. The person cannot tolerate the heat. If the woman, if she is cooking also, there also she can't tolerate the heat. So intolerance to the heat. Increased activity of bowel movements. Difficulty in sleeping, nervousness and palpitation, increased respiratory rate, increased moisture of the skin, the soft and fine hair, wandering mind, there will be weakness, muscle and the nervous weakness are present. When you see same things, hypothyroidism, there will be mild weight gain, heart rate is decreased, intolerance to the cold, the person cannot tolerate the cold conditions. Person may suffer with the constipation, memory problems, coarse and dry hair, slow speech movement, slow walking, dry skin, brittle nails, fatigue, irritability, infertility. These are all the some features that you symptoms or signs that you come across in hypothyroidism, persons with hypothyroid. So in general, this is a picture where you are seeing poor memory and concentration, poor hearing, hoarseness of the voice in the larynx, heart is slow, muscular delayed reflex relaxation, extremities are cold, general fatigue, hair loss, lungs, shortness of breath, skin, myxedema, constipations in the case of GIT, repetitive menorrhagia is seen. So these are some of the features, signs and symptoms that you see in the hypothyroid case. Yes, the diseases which are related to the thyroid gland is goiter. The enlargement of the thyroid gland is called as a goiter, where it is due to the deficiency of iodine. Iodine deficiency leads to a condition which is called as the goiter. The features here is, you can see there the picture swelled neck, there will be a breathing difficulties, cough, hoarseness of the voice, there might be a swallowing difficulties also. It is due to the enlargement of the thyroid gland where you get a condition which is called as that of the goiter. In conditions of hypothyroidism, insufficient production of the hormones, it leads to, because larynx growth is reduced with dysphonia. The common change that can occur is deepening of the voice. It might be because of the thickening of the vocal cords. This lowers the fundamental frequency of the vocal fold, causing them to thicken. So other changes include hoarseness. Already I have think unexplained dry cough might also be persistent with hypothyroidism. Hyper, it involves excessive secretion of the hormones. It causes a voice change such as slight vocal instability, shaky voice. You can see some persons when they are talking, the voice gets a different way of this one will be their voice. Breathing quality is different, reduced loudness, direct inflammation of the thyroid by some cancers may also lead to that of your vocal folds, that is change in that of the voice can be felt. One more condition, hyperthyroidism, as such we have discussed earlier also, but this disease is called as Graves' disease. It is a condition resulting from increased level of T3, T4, where there is moderate enlargement of the thyroid gland along with a condition which is called as exophthalmos. You can see the exophthalmos where the lid retraction, you can see the lid, upper lid there, it is retracted and there is enlargement of the thyroid gland. So these features they contribute to a condition which is called as that of the Graves' disease. Even in that of the goiter also you can see, but here it is a moderate enlargement, there it is a full enlargement of the thyroid, but here it is a moderate enlargement is there. Along this there is one more feature which is called as that of the exophthalmos condition is there, that is a protrusion of that of the eyes. Hypothyroidism, the condition, it is a condition resulting from reduced level of T3 and T4 resulting in goiter, puffiness of face, periorbital swelling, loss of scalp hairs, ptosis or drooping of the eyelids, dry, thickened, rough and yellow skin are the kind of features that you see in hypothyroid condition. In cases of severe thyroid disease, the thyroid must be completely removed. Errors in surgery, if you are doing the surgery, it may also change the voice because thyroid is also affecting that of the voice also. If recurrent laryngeal nerve, because along the thyroid gland there is a nerve which is called as recurrent laryngeal nerve. It is injured during the removal of the thyroid, there might be paralysis of the vocal folds leading to weaker, breathy and harsh voice. Along with the thyroid gland, the one more gland which is present posterior to the thyroid is parathyroid gland. So what is, we have said, thyroid does the functions opposite to that of the parathyroid gland. So what is that we see? In humans, there are 4 parathyroid glands which are essential for that of your life. So as their removal can cause death from asphyxia, if it is removed, the person dies due to a condition which is called as asphyxia. But there are 4 parathyroid glands which are present on the posterior surface of the thyroid gland. This is the cut section of the parathyroid gland. When you take the cut section of the parathyroid gland, you come across the chief cells. And some other cells in between it. What you can see is oxyphilic cells. So the main function of the secretion of the chief cells is parathyroid hormone, which increases the blood calcium level. Earlier you have seen that thyroid hormone decreases the blood calcium level, whereas the parathormone increases the blood calcium level. So this is that opposite function we say it. Yes, the parathormone as it causes increases the blood calcium level. Yes, the disease related to parathyroid gland is, if it is not functioning, what happens? Because it increases the level of the calcium level. If it is not functioning, rickets. So rickets is a disease characterized mainly by the bone deformities. You can see the children suffering with the ricket, deformed bones, thick wrist and the ankles. There might be retarded growth. So that is one more condition is called as osteomalacia. This is due to the inadequate absorption of the calcium. Inadequate absorption of the calcium is due to the deficiency of the vitamin D and calcium. So which causes the inadequate absorption of the calcium, leading to a condition which is called as osteomalacia. Mainly the disease is limited to the females and usually appears after multiple pregnancies. After multiple pregnancies or after giving milk, that is a lactation period, you come across this condition because where there is inadequate absorption of the calcium, that is osteomalacia. Hypoparathyroidism. It is abnormally low level of calcium in the blood. So abnormally, if there is low level of calcium, the characteristic feature is psychiatric disturbances, paresthesia, and there might be a development of the cataract also because of abnormal low level calcium in that of the blood. Hyperparathyroidism. What is happening if there is more parathormone secretion? Is formation of the calculi, because calcium, it regulates the calcium, so there is a formation of the renal calculi, polyuria, polyuria, and number of times you go to the washrooms. Polydipsia is thirst, anorexia, eating difficulties, that is more you eat, muscle weakness, general fatigue, calcification of the soft tissue. This is due to the excessive secretion of the parathyroid hormone. One more hormone of pituitary that it secretes adrenocorticotropic hormones. So it is secreted by pituitary gland. It is often produced in response to the of your biological stress, if there is stress at that time. So main thing, it principally affects our increased production of release of corticosteroids. So the main important function is steroids, release of the of your corticosteroids. The adrenocorticotropic hormones is helpful for the production and release of corticosteroids. Yes. One more is follicle stimulating hormone is a hormone which is secreted from the anterior pituitary gland. The main function is follicle stimulating hormone regulates the development of the growth, puberty, maturation and reproductive process of the body. Luteinizing hormone. This hormone is helpful for it triggers ovulation, helps for development of corpus luteum. In males, it stimulates the production of testosterone. Yes, that is about the anterior pituitary hormones. Now coming to that of the hormones which are secreted from the intermediate lobe. Normally the intermediate lobe, the only one hormone, that is melanocyte secreting hormone. So these melanocyte secreting hormone of two types, alpha melanocyte secreting hormone and beta melanocyte secreting hormone. The main function of this is it stimulates the production of melanin by melanocytes for skin, the black color of skin and hair. It is because of this that it's secreting hormone. It signals to the brain and have the effect not only on the top of your hair and skin, on appetite and also in that of the sexual arousals. So the main function is in that of the melanocytes, which is responsible for that of your coloration of the skin and that of the hair. So by now we have completed the what the anterior pituitary hormones, what it is secreting. We have done with the anterior, that is melanocyte stimulating. Now let's see the posterior pituitary. So what is posterior pituitary hormones are? Antidiuretic hormone is a hormone which is secreted from the posterior pituitary. It is a hypothalamic hormone synthesized in the supraoptic cells nucleus of the hypothalamus. Antidiuretic hormone is stored. It is synthesized in the hypothalamus, but it is stored in that of the posterior pituitary. Pituitary gland stores its hormone which is called as vasopressin, which is antidiuretic hormone. The other hormone of posterior pituitary is oxytocin. So oxytocin is synthesized in the hypothalamus, but it is stored. So posterior pituitary is the storage hormones, not only for antidiuretic hormones and also for the oxytocin. So these oxytocin and antidiuretic hormones are stored in posterior lobe of the pituitary gland. Yes. The function of antidiuretic hormone is to retard. That condition is called as diabetes insipidus. Is a condition when vasopressin is not insufficient. What is happening is there is excessive thirst and there is excretion of large amount of diluted water, leading to a condition which is called as diabetes insipidus. It is a disease which is related to the antidiuretic hormone. Is as such, where there is polyuria, more times a person goes for that of your washrooms, large production of urine, about 2 to 3 liters of the urine is passed. Whatever water they are having, that much amount of water is also lost. Now the other oxytocin. So we said posterior pituitary secrete two hormones, ADH and oxytocin. Now what is the action of oxytocin? Oxytocin is helpful for the contraction of the mammary gland, milk ejection reflex. So for the contraction of smooth muscles which are present surrounding the mammary gland. So that is the action of the oxytocin, that is the action of the mammary gland. It is helpful for the contraction of the mammary gland. Other hormones are testes, that is the testes and the ovaries. The testes which are located within the scrotum. This stimulates the development of male sexual characters. Ovaries in the pelvic cavity produces both estrogen and progesterone, responsible for the female development like menstrual cycle or the growth of the female. It is what the ovaries are doing it. So these are the both testes in case of males and ovaries in case of females. So these are all the things that are secreted by the sexual hormones. Testosterone, which is the influence of the testosterone, where it is on the skin, male sex organs, sperm production, prostate growth and erectile function. On the muscle, it is helpful for muscle mass and strength. On the brain, this testosterone is helpful for positive feelings, sex drive, aids, coordination and memory. On the bone marrow, helpful for the RBC production. On the bone, it is helpful for the maintaining the bone density is maintained by means of the testosterone. Yes. So this is the effect on estrogen, as such we have seen earlier also. On brain, it regulates the body temperature. On the heart and liver, it is helpful for the production of the cholesterol in the liver and decreases that of the plaques if there are any plaques constrictions. So this estrogen decreases. Ovaries stimulates the maturation of the ovaries. On vagina, estrogen stimulates the maturation of the vagina, helps and keep the vagina lubricated. On the breast, estrogen is helpful for that of the milk ejection reflex, that is milk production. On uterus, stimulates the maturation of the uterus, prepare the uterus for that of the nourishment of the fetus. on the bone. Estrogen helps to preserve the bone density. So these are the some of a few functions of the effects of the estrogen. When you see that these are the sex hormones, what we are seeing, when there is sexual hormonal imbalances, what changes you find it? During certain times in life, the female voice production may change. Irregular because of sexual hormone imbalances, there might be irregular menstrual cycle, which occurs with puberty, puberty onset, during the pregnancy, during menstrual cycle, menopause. These may all affect or alter the female voice. The vocal fold swelling that naturally occurs during menstruation may result in hoarseness, reduced pitch, the range of the loudness, loss of stability of the phonation, which these are all the conditions. It might be because of the imbalance of the sexual hormones or the hormonal imbalances. Grenier referred to this as premenstrual vocal syndrome. This syndrome includes vocal fatigue, reduced pitch range, hypophonia, loss of some harmonics. It typically begins 4 to 5 days prior to menstruation. So 4 to 5 days prior to menstruation, you see this condition which is called as the syndrome, premenstrual vocal syndrome, where there is vocal cord fatigue, reduced pitch, hypophonia, loss of some harmonics. So these features together is characterized as syndrome, which is called as premenstrual vocal syndrome. Vocal pitch is typically most affected by hormonal imbalances that only. Virilization is the abnormal secretion of androgenic hormones in females. Testosterone. If testosterone secretion is more in that of a female, then that is condition is called as virilization. Virilization is abnormal secretion of androgenic hormones. This may result in male gender characteristics like what the female may have virilization, that is vocal effects are low pitch, hoarseness and occasional voice breaks. This sensitivity to hormonal change is more common in females than in males. On voice, what is the effect? On occasion, the cause of patient voice problem is endocrine dysfunction. The endocrine dysfunction may also cause a voice change. Changes in endocrine activity can have major impact on developing of larynx, causes altered fundamental frequency leading to person's voice to be either too high or too low pitch voice. These are all the endocrine effects on the of your voice. Yes. So these are the top the endocrine, some of the endocrine glands. Just going through that one. So we have seen pancreas. Next, coming to the top of your pancreas, what it is. So here this is a cut section of the pancreas. You can see the pancreas. It consists of both exocrine and the endocrine part. The exocrine glands are the pancreatic glands, which consists of exocrine acids, which pour their secretions into the of your ducts. But the endocrine part is, these are the alpha, beta and delta cells, which secrete. Beta cell secretes insulin, delta cell secretes somatostatin, alpha cell secretes glucagon, because these are the hormones. As such, earlier only we said, so this is a type of a gland which is heterotrophic, that is heterotrophic gland which has both exocrine function and endocrine function. Exocrine function is, it secretes that of the, pour the secretion into the duct, that is exocrine. Endocrine is secretes hormone like somatostatin, insulin, glucagon. So islets of Langerhans secrete this alpha, beta, delta cells which secretes a hormones, whereas the pancreatic acids secretes the digestive juices. Yes. Now coming to the hormones, pancreatic hormones, insulin. So the insulin which is secreted from the of the, when you have seen here the insulin, it is secreted in the beta cells. The beta cells which secretes that of the insulin. What is the action of insulin? Pancreatic hormone insulin. What does it does? On carbohydrate, insulin increases the glucose entry into the most body cells. Insulin produces hypoglycemia. Yes. On protein, it promotes amino acid uptake, decreases the protein metabolism, promotes protein synthesis, especially on muscles. When you see diabetes mellitus, it is a condition which is related to insulin only. What is happening? It is a group of metabolic disorder in which there is a high blood sugar. For a prolonged, the high blood sugar produces frequent urination, increased thirst, increased hunger. Yes. Glucagon is another hormone which is secreted from that of the cells of the pancreas. alpha cells, beta cells, delta cells. So in that one cell, glucagon is produced. Glucagon acts mostly on the liver and the adipose tissue, where it antagonizes the action of the insulin. What insulin is doing? Its opposite function, the glucagon does. It stimulates glycogenolysis, promotes gluconeogenesis. It is the opposite action of the insulin the glucagon does. Somatostatin, a hormone that is widely distributed throughout the body, especially in the hypothalamus and pancreas. The main function of somatostatin is it regulates the endocrine and nervous system functions. So both are regulated by means of somatostatin. Yes. So that is about the pancreas. Next. Coming to that of the adrenal gland or suprarenal gland. There are two adrenal glands about 4 centimeters long and 3 centimeters thick. When you see the cut section of the adrenal gland, what you see is outer cortex is present. Outer thing that you are seeing is the cortex and inner thing is that of your medulla. Cut section if you take, this is the outer cortex part and inner medulla part. The outer cortex part secretes 3 hormones such as glucocorticoids, that is cortisol, mineralocorticoids, aldosterone, sex hormones, testosterone or androgens. So these together what the adrenal cortex are producing, these are collectively called as adrenocorticoids because they are secreted from the cortex of the adrenal gland. So these glucocorticoids, mineralocorticoids and sex hormones together, all the three together they are called as adrenocorticoids. Yes. Next, coming to that of the glucocorticoids. What are glucocorticoids? Cortisol, corticosterone and cortisone are the 3 main glucocorticoids. These are essential in life for regulating metabolism and stress. For regulation of the metabolism and for maintenance of the stress, cortisol, corticosterone and cortisone are important. They are high in between 4 to 8 am. At that time, the glucocorticoids will be high in their function. The low at the mid time between that of your mid time at 3 o'clock, it will be low their function, but more peak at the level of 4 to 8 am. So cortisols are main glucocorticoids which are helpful for regulating and metabolism of the stressor. Yes. What is the effect of this one? Gluconeogenesis, formation of new sugar, lipolysis, that is a breakdown of triglycerides. In pathology and pharmacology, they have an anti-inflammatory action, suppresses the immune response, suppresses the response of tissue to injury. They are also aiding for that of a delayed wound healing. Mineralocorticoids, aldosterone, is a main mineralocorticoid which maintains water and electrolyte balance. That balance, water and electrolyte balance, is maintained by means of mineralocorticoids. One more, the adrenal glands, the cortex of the adrenal gland secrete is sex hormones, androgens. Androgens are the main sex hormones which are helpful to that of the onset of the puberty. Yes. What are the disorders of the adrenal cortex are? The first syndrome is Cushing syndrome. It is due to the hypersecretion of glucocorticoids. The main characteristic feature of this syndrome is pain in face. There will be pain in face, neck and the abdomen region. There might be some fractures in the limbs, that is pathological fractures, diminished protein synthesis, suppression of the growth, hypertension, menstrual disturbances in case of females, peptic ulcers. So these are some of the characteristic feature of Cushing syndromes. Pot belly appearance, that is also there. Cohen syndrome. This is due to excessive secretion of mineralocorticoids. It usually affects the tumor, affecting only to that of the one adrenal gland. Where there is muscle wasting, hair, exophthalmos condition, goiter, tachycardia, weight loss, oligomenorrhea, and you can see the tremors. This together called as a syndrome which is called as Cushing syndrome. Addison's disease. It is due to the hyposecretion of glucocorticoids and mineralocorticoids. The effect is muscle weakness, vomiting and diarrhea, tiredness, mental confusion, low blood volume, hypotension, loss of body hairs in case of the women. So these are the features in case of Addison's disease, where it is due to the hyposecretion of glucocorticoids and mineralocorticoids. So those are what the adrenal cortical hormones are. Now coming to the adrenal medullary hormones. So what are the hormones which are secreted from the adrenal medulla? It is surrounded with a cortex. It produces. So the adrenal medulla is surrounded by the cortex. It produces two hormones such as adrenaline and noradrenaline. So adrenaline and noradrenaline are the two hormones which are produced from the suprarenal gland, that is the adrenal medulla. So what is its function? Noradrenaline and adrenaline are released in the blood. When you see the structures of both, they are very similar and have similar effects. Together they potentiate by increasing the heart rate, increases the blood pressure, increases the metabolic rate, dilating that of the pupils. So these are the effect of adrenaline and noradrenaline. The effect of excess adrenaline and noradrenaline are hypertension, hyperglycemia, raised metabolic rate, nervousness and headache. So these are the effects of excess amount of adrenaline or noradrenaline. The next endocrine gland is a thymus gland. Yes, thymus is located in the anterior part of the upper mediastinum. At the upper mediastinum part, you can look after the thymus. At birth, it is about 10 to 12 grams. During childhood, it grows up to 30 grams. But after later, it is again regressed. So, up till the old age, the thyroid gland comes to 3 to 6 grams. Yes, it is responsible for the maintenance of the T lymphocytes, the production of the T lymphocytes. The main hormone that you get from the thymus is thymosin. It is required for the development of T lymphocytes and also for the other immune cells that it is needed, that is cell mediated immunity. So T lymphocytes are responsible to maintain the T lymphocytes, which is helpful for the development of T cells and also for the other immune cells, that is T lymphocyte for cell mediated immunity. Yes. In endocrine system, up till now what we studied is various glands of the body, what the hormones that are secreted. So what is the necessary to study for this one? What implementing the gaining the knowledge here? By this, I think you can know the better and quality can be improved nursing care. The betterment and the quality of the nursing care can be enhanced. So thank you, ma. Yes, the endocrines are also covered in the physiology part also. There is as such in anatomical part, the regulations as such we will not be telling, only what its functions are. Normally what its function, what are the disorders. So same thing I think you might have also covered in physiology. Yes, if you have things, you can go across these slides again and read it again, and you can, if there is any confusion, I think to a part of the extent the confusions can be removed. So whole in whole, what we have discussed in towards gland is, we came across the pituitary gland, thyroid, parathyroid, adrenal gland, pancreas, thymus. We have seen their location, their functions, their disorders. Along with that, we have divided as such, we have classified the glands as exo, endo and heterogeneous glands. So by now I think you have got to know what are the exocrine glands, what are endocrine, what are heterocrine and glands you came across. Along that, We have done the endocrine glands in detail. So we have seen where they are situated, what is the location there, what are the function, and what disorders to it to your extent. So I have not covered very elaborately, ma. To your extent, what it is needed. That much I have, up to my extent of knowledge, I have done this class. So thank you, ma. Yes. See you. So there is, and one more thing. There is the one system that is remaining, that is a reproductive system. So I think on Monday's class, one and a half hour class, I think we would be completing. Yes, that complete same way even in the urinary system. Sir will be covering the kidney. I think today it is covered, urinary bladder and the part of urethra and ureters will be covered there. So with that, I think by Monday, if possible, we will be trying to end our class. Thank you, ma. Yes, if there are any doubts, please put your doubts so that we, up to our knowledge, we try to answer to your doubts. Thank you, ma.